Right, good morning, everybody. My name is Andrew Barrier, and I'm with Project Foodbox, and I'm looking forward to speaking with all of you today. So I'm actually here with my colleague, Seda Khan, who will also drop our contact information here in the drop or in the chat. So just real quick, a little bit about the program summary and why we're here today. So we're actually part of the new medically tailored meal benefit program as part of CalAIM. And if you're familiar with that, CalAIM is really about reimagining what Medi-Cal will look like for their members. And it was launched in 2022. So we started out in Orange County. What we do is provide a free weekly food delivery directly to the member's doorstep with our logistics vans. And it's 18 to 20 pounds of fresh fruits and vegetables. We put 15 to 18. We always exceed that number. But it's a total of 24 total weeks. You get authorized for 12 weeks and then you get reauthorized for another 12 weeks. We don't make up the number. This is part of the managed care plans that have done this. So it's a kind of a moving target. So who's eligible? This says Orange County, but we are in LA now. So it's all Medi-Cal members that are residing in Orange or in LA County with a qualifying condition are eligible. And it's a very quick onboarding and intake process that a new member can receive the food delivery in 1 week here in Orange County. In LA, it's been about 2 weeks because of the managed care plan. So in LA County, it's about 1/3 of the population. Well, about 4 million people are in Medi-Cal alone in LA County. If you didn't know, 15.5 million people are on Medi-Cal in the state of California. Again, so about 1/3 of the population. So there's a huge need for this benefit. So just real quick about who we are. So our parent company is Sunterra Produce, and who we are and the genesis of Project Foodbox really stems from this. And we're just your typical grower, packer, and shipper of fresh produce since 2000. From a friend Steve founded it back then out of Brawley, California. If you know where that's at, it's tucked away next to the Arizona-Mexico border. And what we do besides grow the produce ourselves here locally is we also partner with multi-generational farms to source their produce and bring it to market. So what does that mean? Our typical customers are going to be your Whole Foods, Trader Joe's, Walmart, Costco, Stater Brothers, to hotels and hospitality companies, casinos, schools. And then if you've had a double-double recently, keep eating those double-doubles. I know this is a health conversation, but we do provide the lettuce to In-N-Out Burger. So I bring that up because 60% of our customer base at the time during the pandemic were those hospitality companies. And for farmers like ourselves and across the country, they had no place to go for their produce. So the USDA created what's called the Farmers to Families Food Box program. And what that allowed for us to do is to work with a community-based organization like yours, the nonprofits, the NGOs. We work now with all the food banks, LA Food Bank, OC Food Bank, Second Harvest, now all of them really west of the Mississippi. As they like to say, they want front-of-life produce, and that's what we do, is provide them beautiful produce to them so that their constituents can receive it. And one of the things that would, really made us realize there's a huge need because of food insecurity. Food deserts are real. My team and I are out there at events, and we see people who can go by 6 different liquor stores, but they can't go. They have to go 6 miles to the nearest Walmart to get produce. So that's what we're addressing here and why we're here today. This picture right here on the right side is really what led us to getting on the map, or people became aware of what we were capable of doing. And this gentleman's name is Blackfeather. We got connected with some friends up in Utah and the government there, who connected us with the Navajo Nation out of New Mexico. And this gentleman here heads up kind of like their whole community. And he was able to bring 250,000 plus boxes just in the end of 2020 to the Navajo Nation, a community that was decimated by the pandemic. And it's because of our ability to bring resources together and beautiful produce, the managed care plan CalOptima reached out to us and said, "Hey, would you like to be part of this medically tailored meal program?" So if you are familiar with it, the medically tailored meal program was initially a pilot in 2018 up in the northern counties. And what it really was for is really to address the actual healthcare costs. And what they found is by eating healthy, who knew, is you're going to reduce hospital stays and healthcare costs. So DHCS made it part of the CalAIM program that is a 5-year initiative until 2027. And what we're finding and what they found specifically is that by addressing poor health outcomes associated with food insecurity, we can actually tackle these healthcare cost issues. We can keep people out of the hospitals. We can support complex care needs, especially for those kids and then their parents and their mothers, supporting specialized dietary requirements. We have 25 registered dietitians on our staff now, managing chronic conditions, and again, ultimately reducing those hospitalizations. So far, we've delivered to nearly, I want to say it's over 40,000 members just in 1 year in this program. We do it very quietly. And because of that, we've really become one of the most favorite parts of their week when they receive that food box at their doorstep. And 76% of the members that we've served have 2 or more chronic conditions. That's really intense. 30% of them have 4 or more chronic conditions. That includes mental and behavioral health as well. So there's a significant need for this benefit. So real quick about the eligibility criteria, as you're probably already asking, and because I'm going to get to it first, is there is no age requirement. However, our registered dietitians, because chewing is a requirement, you have to be 1 year old to infinity, and you have to have Medi-Cal. So right now with LA, this is based on DHCS's outlines. You have to have one of these 3 criteria to be eligible. And I can tell you from our experience with CalOptima and HealthNet and IHP is that they're not looking to push people away from the program. They're really looking for people to be on it. It's been a very inclusive program. So step 1 is that chronic condition. This is really how most people come in, and they could have diabetes, pre-diabetes, cardiovascular, mental and behavioral health disorders. We've seen anxiety, PTSD, depression, ADHD. Again, the list is very, very long. This is not an exhaustive list. So that's the main way people come through, is some type of chronic condition. And the second one is individuals being discharged from a hospital or skilled nursing facility, and then individuals with extensive care coordination needs. So maybe there's someone who has special needs or some type of disability that doesn't allow them to get to, a store. So real quick, everyone cares about what's in the box, and we love the box. We kind of gloss over this because we're farmers at the end of the day, and what we've really done is recreated the food delivery system here in California by bringing beautiful, healthy produce straight from the farm within 24 to 36 hours, straight to the doorstep of the Medi-Cal members' doorstep. So those 25 registered dietitians create our box options, and there's 6 of them. That's a diabetes box, a cardiac box, a renal box, a cancer and immune support, low sodium, and then one of those gluten-free boxes for those members that are gluten-free. And so what you'll see here, and this is not the best example, but you take a look at our Instagram, please, is celery. You have asparagus, you have Brussels sprouts, you have a couple shelf-stored items that we put in there, like beans and rice or lentils, depending on what's culturally appropriate. And then you have higher end items. Every box comes with multiple types of fruit, and you'll see the Driscoll strawberries here. We use a packer and a grower called Gem Pack. And so we have strawberries, avocados, mangoes, blueberries, blackberries, sometimes passion fruit, depending on the season. And I bring that up because, as you're probably well aware, working with the people that you are working with, these items are really outside the maybe the budget for this demographic. So this box is about $70 worth in the store. They receive it each week. So bringing $280, $300 worth of produce to a family and an individual that really needs it, it has a significant impact. So we're super excited being able to bring this to them. And the growers are ready, by the way. They love it. So real quick about how this works. This is across all the counties that we're operating in. We're starting to get into Central and Northern California, but the step is a 5-step process. Again, it's typically 1 week in Orange County. It's been about 1.5 to 2 weeks out there in LA County, but step 1 is how they're referred in. Step 1, it can be a provider. So it could be a case manager. It can be a case liaison. It could be actually a friend or a family. We don't need any medical proof. It's not part of the program. DHCS does not require any type of medical proof. But what makes this program unique, and this is why we're doing like 20 plus events a week out in the community, we're meeting people where they're at. We're working with organizations like yours. because you have the trust of the community. It's easy to wave the free flag. However, it's really about trust, specifically with this demographic. So members can self-refer, meaning they can see us at an event, they can find our website, they hear about us through the doctor or dentist, etc. And they say, hey, I'm Andrew, I have Medi-Cal and my chronic disease, I have high blood pressure. Okay, great. They sign up with us, which if they don't call us directly, they'll sign up through our form or website, and our member success team, which is step 2. They're multilingual. We also have a translation service that can translate up to 120 plus different languages. So we're very inclusive in our process. They reach out typically within about 30 minutes of them signing up, and it's just confirm the information. Are you who you are? Say you are. It takes about 2 minutes. What's your contact information? What's your delivery location? A couple other qualifying questions, which will then be sent over to those 25 registered dietitians. So those members that we're serving, we're delivering to 20,000 members per week right now. Those registered dietitians create that menu, and they say, hey, look, you have a diabetes box. And then that member may say, hey, look, I have an allergy. Okay, let's not put that food in there. We want to make sure you're eating the produce. The farmers want to make sure you're eating the produce, right? So we make sure that the box is poultry appropriate. We also make sure that if you don't like certain items, I'm not a broccoli fan. If there's broccoli in it, I'm not going to touch it. So we don't want that to go to waste. Members tell us all the time that they may not like a certain, leafy green. So we replace it with another leafy green with the same nutritional value. So from there, those members or those menus go down to our packing house, and we pick the produce. So what today's Monday. So yesterday morning, our team out there in the farms, they picked it, they packed it, and then they put in their nice cooling liners, cooling packs. This box is really akin to more of a Hello Fresh, but it's fresher. It's fresher than the store. It's fresher than what's in from those type of companies, because we're able to source it from our farms. And so they pack it up, they ship it up to our distribution centers in LA, and we have these Amazon style vans that we're delivering straight to the doorstep of the Medi-Cal members for free. So this is a health benefit that, again, takes about a week for them to receive. In LA, it takes about a couple of weeks, and really excited about being able to deliver that. And we're getting to the point where essentially we're delivering it same day, every day at the same time to the members. So finally, how we're working in the community, and it's really just bringing awareness, making sure people are aware that there's this beautiful, wonderful, really impactful benefit that can help you really improve your health and prevent any type of chronic diseases, which is nutrition. So how we're working in the community is, we got connected here with the first 5 LA, with our first 5 OC friends that we've grown a relationship with. And so we have these flyers here that we distribute amongst all of our organizations that we have at our events. And we have this in all the main languages of LA County. They can call the number, and we can make sure you get these flyers, and then they can scan the QR code. Most people are just going to call the number. The other way is just, sending out information. Maybe you want to do a newsletter or do some type of social media blast, flyer distribution. And so I'll leave you with one thing. There's a couple things really is, about 40% of the produce that's grown or harvested is actually wasted. 20% of it is, even for us, is left in the field. We know when we grow a field of lettuce that 20% of it's going to be left in the field, so it goes to waste. The next 10% of it's the restaurants we eat at. It just goes to waste. The remaining 10% is everybody on this call, and maybe not all of you, but most of us do waste food. We throw food away. So this is not a grower issue. The farmers we know and the farmers we have relationships with are ready to provide this produce to the people, and it's really an access to food issue. So I'll leave you with one question to think about is what if we ate every apple that we harvested? Like, what would our community and what would our kids feel like at the end of the day? Like, would we have these health issues? So that's what we're here today, is bring awareness. And I want to thank all of you for your time today. And First 5, just shout out to you and everything you guys do in the community. Appreciate it. Thanks.
Thank you so much, Andrew. I think we have one question in the chat box. What areas in LA do you serve? And I know you briefly mentioned about homeless families, but just in case they need a little bit more clarity.
Great question. So all of LA County. Yep. So all of LA, Inland Empire, Orange County. Yeah. So our goal is to be contracted in every county. We're working through that process right now. Homeless families, as part of DHCS's guidelines, the unhoused are not eligible for the program. They have to have an actual permanent address. Now, there are some caveats there. I would have to talk with my member success team who, some shelters accept the boxes, some organizations will actually receive the boxes. It's really, but they do have to have an address that they deliver to. There's a couple other things. So there's a great question. So again, there's no age requirement. Again, the youngest our registered dietitian will write though is one because of the chewing requirement. Second part, this is a per member household or per member benefit, not per household. So we have multiple members in a household receiving it, which is a lot of food. So if it's 3 people, that's like 60 pounds of food. And the third thing, and most importantly, and this is why we work so closely within the community organizations, is the fact that people get touchy about their benefits through the government or other things that they may be receiving. This does not impact any of their other health benefits, CalFresh, food stamps, anything else that they're receiving. The answer is always no if someone asks you. So that's a really important one to know.